Our next speaker is Robert Adhieh, JD. Robert Adhieh is as interesting, passionate, and brilliant as his professional titles are long. I wonder if Texas A&M Human Resources knows that he holds down 3 full-time jobs. He is Dean of the Texas A&M Law School, he is Chief Operating Officer of Texas A&M Fort Worth, and he's Vice President of Professional Schools and Programs for the Texas A&M system. Bobby is a lawyer by training, but to me looks like a world builder in practice. Since becoming dean, Texas A&M Law School has had the fastest rise in ranking in the history of law school rankings. A&M is 1 spot out of the top 25 national ranking now and is in top 10 in multiple specialties. In his spare time, Bobby is leading efforts to bring Texas A&M Fort Worth to fruition. He'll tell you more about it, but A&M coming to town is a monumental event for our region. One of the world's largest universities has decided it should build its first urban campus in our fair city, that it should center around research, and that its activities be built to serve North Texas needs. Bobby prepared for all this terraforming by graduating from Princeton School of Public International Affairs and Yale Law School. I don't really know how to tie in his article on the post-Soviet constitutional crisis he wrote in law school, but it is too interesting not to mention. Please welcome Robert Adhieh.
I don't know how many Aggies are in the room, but after 7 years of training, oh good, Arkansas, howdy! Oh my God, good, I love it. You people are everywhere. No, it's good. So it's a great honor and pleasure to be with you today. When Will asked me to speak today, I reminded him that I'm not a doctor, I can't even play one on TV. I think I'm primarily here for 2 reasons, really 2 people. First, Will, before Will came to town, I fancied myself, and I think I had some brand as, the fastest talking at least, and maybe the most kind of generous and rich, I'm putting it charitably, in ideas for everyone and everyone who came along. And then Will came along, and now he's my hero. Now I'm just kind of a pupil at his feet. The second one is my mother, and really I should say my mother and all the other doctors in my Iranian family. If you know anything about Middle Eastern culture and Iranians, I can speak in particular, they were deeply disappointed to hear that I was going to become a lawyer. Like this was somewhere slightly above taxi cab driver, or garbage man. And so I was one of those kids who, the meme out there that you're sitting on the airplane and they say, is there a doctor on the plane? And my mother would say to me, maybe they need an estate plan before they go. You should rush over to help. So I'm very proud that I to report to my mother, assuming it goes at least moderately well, to report to my mother that I presented at a medical research conference. She won't believe me, but again, maybe we'll have some pictures or something I can show her. I really have 2 tasks as I see it today. First is to convey on behalf of the Texas A&M system, our leadership, Chancellor John Sharp, our Deputy Chancellor Billy Hamilton, and really the entire team at the system, as well as the entire team at the university, including at Health Sciences and Medical School and other divisions of Health Sciences, kind of our enthusiasm and excitement about being in Fort Worth, but as importantly, partnering with you all at Cook Children's and in the medical community in Fort Worth, and in Dallas-Fort Worth beyond that. So that's task number 1. Task number 2 is to get your ideas on how we can develop and deepen and expand those partnerships. And I hope that I'll put out some ideas that we have been discussing here and there. But I hope in Q&A, if there are other ideas, I promise to, as best I can translate them to what I understand, I will memorialize them and make sure we pass those on. In terms of our enthusiasm, I think of the Cook Promise. Will, for those of you who were at dinner last night, read, knowing every child's life is sacred, we promise to improve the well-being of every child in our care and our communities. As I think about that promise, it really echoes very much, I think, the promise, the aspiration, the goal of Texas A&M University. We are a land, sea, and space grant university. As land grant universities go, I think A&M is one that thinks of itself in a serious, significant way as trying to figure out how to improve the lives of every Texan every day. That, of course, I hope you see as resonating very much with the Cook Promise. And so the partnership between A&M and Cook Children's that we are beginning to build and hope to continue to build really has great promise for that reason. I was just telling Will also that, again, another reason is, again, as you heard from the whoops and so on and so forth, for the non-Aggies in the room, when you're an once you're an Aggie, you are forever an Aggie. I think most Aggies in their coffin are doing this. The embalmers position them to do that. But I could say something similar about Cook Children's in the sense of, I believe, as far as I can tell, under the HR rules at Cook Children's, you are never allowed to leave. It's the Hotel California of hospitals and healthcare systems. I was telling Will the first time that I was sitting with a group of folks from Cook Children's, and I'm a lawyer, I ask questions, and so I said to them, how long have you been with the hospital? And the first person said 17 years. And I was like, whoa, 17 years, that's very impressive. And it turns out they were the shortest term, like of the three. And so I think that reflects something incredible about Cook Children's, and I think it reflects a reason for this partnership between A&M and Cook Children's to achieve a great deal. So what I want to do over the few minutes that I have before, again, opening it up for your questions and really your feedback as much as anything else, because I'm not sure there's a lot of questions that you will ask that I could answer. But I want to start by saying a little bit about what A&M is hoping to do, what A&M aspires to do in Fort Worth, what we're trying to pull off here. Number two, share a little bit about A&M Health Science, the A&M Health, the broader Health Science Center, but also about the School of Medicine. Talk some about, some of the collaboration ideas that we have begun to discuss, begun to explore, and then say a little bit about the physical manifestation of all this, the campus that we are trying to build as well. So let me launch into that. Starting with, again, a little bit of what A&M is trying to do here. So the first thing to say is that obviously A&M is a statewide institution. Obviously, we think of it as College Station, but really it's spread over every single corner of the state of Texas. So why Fort Worth? Why is it that Fort Worth, again, as Will mentioned, has A&M decided for its kind of first substantial, comprehensive, broad-based urban campus to have that be here in Fort Worth? So really, again, in many ways, it comes down to growth, right? Growth, not just a population, although that's a piece of it, but also growth and opportunity. The number of businesses that are coming in here, the number of new research initiatives that are coming, and even the other universities. So I tell people I wasn't born in Texas, so I haven't internalized the idea that because your football team beat my football team in a football game 38 years ago, I hate you. Seems a little weird to this Northeasterner why I would hate someone over that. But in part, A&M has adopted that notion here in Fort Worth as well. And we really think of this as an opportunity to bring together as many higher ed institutions as are interested in being part of this enterprise of really driving innovation, economic growth, entrepreneurship, et cetera, here in Fort Worth. And so Fort Worth really is a ripe location, is a ripe setting for us to undertake that effort. So what's the vision then of what we are trying to do? From the get-go, the theory was that we might aspire to create something that brings together the very best of higher education with the very best of industry, and I mean here industry broadly defined, to include hospitals and healthcare systems and startups and other community organizations. But that there was an opportunity to create something, a physical space that really brought together in a significant way academic assets of A&M, but also others, along with these community resources of industry, community, hospitals, et cetera, et cetera, et cetera. So the theory was, I think of it as two axes, right? So on one axis, let's have a diverse array of academic disciplines. Not all of them, to be fair. The notion is not that this Fort Worth campus will teach everything. There's enough other universities that are doing lots of incredible and great work that the goal is not to compete with any of those, but to identify those areas where there is an opportunity to add some value to the community, to meet the needs of the community, of the business community, the broader community in different ways. So the thought was, on that axis, we have law here already because the law school has been around here for a decade now, but add to that engineering, significant research as well as academic programs in engineering and workforce training, I should say as well. Medicine, nursing, pharmacy, biotech, business, ag and nutrition in particular, ag with regard to nutrition, and a number of others as well. So let's come up with kind of an array of academic components that we can bring to the table that are of value. And then let's think about how those academic components then collaborate on this other axis with an array of industry partners, in part physically co-located with A&M on this campus that we're building, and I'll come back to at the end. But frankly, more broadly in the community. So even those industry partners that have no need to sort of physically have a presence on our campus, how can we identify opportunities to collaborate with them in a more robust and rich fashion because we're here, right? Because we're visible, present, and engaged. From the beginning, the notion that we had was that this should not be a case of the university saying, as universities often do, saying, this is what we do you want it, right? We have these programs, are any of them relevant to you? Or we're doing this research, would you like to collaborate on it? Instead, from the very beginning, we actually did what we called a needs assessment, with support from the community, that we went and we sat down with hospitals in town, engineering firms in town, aerospace and aviation companies and others, and all sorts of sectors, to say, what are the things that a tier 1 significant major research university would be able to help you accomplish if they had a presence here? As those efforts kind of continued and persisted, they led to the creation of what we call the Fort Worth-Tarrant County Innovation Partnership. We have a board with community representatives, city representatives, and county representatives, all of which have contributed kind of to funding this effort. There's universal consensus that that's too long a name, but that's a project for another day. But this Fort Worth-Tarrant County Innovation Partnership, the notion is that its task is to play out, explore, build out these relationships. And I'm giving, Cook Children's obviously is an obvious example because we're here, but I could say the same thing with Lockheed or with Alcon, or even with companies that aren't here. Think of healthcare companies that are thinking about relocating to Texas. Think about aerospace, film industry players that are thinking about coming to Texas. Part of the task of this partnership is to play out how might A&M and this campus be able to help facilitate Fort Worth being the right choice for that, to bring those companies here. You can see, again, we like pictures, and so the idea is that you got A&M, obviously, the university and the broader system, the city and the county, industry partners, as well as various local stakeholders, all of which kind of have an interest in and engagement with what we're doing in that regard. From there, the notion was, let's identify a set of what we call innovation or industry hubs that would make sense as areas of focus. I don't think any of us are in a position to predict in 20 years or 30 years or 40 years what will be the critical innovation and economic development opportunities for Fort Worth, for Tarrant County, and for the Metroplex more broadly. But we can look at what's on the table now. We can look at where national trends are going, what local opportunities already exist that we might build on. And around that and the conversations, including with Cook Children's and others, we identified these 7 industry hubs, as we call them. The top set of them are kind of more broad-based, so there's kind of a catch-all one, that's the first community engagement one on the top left. Education and workforce development, we identified as a second kind of area of kind of broad engagement. So workforce development, whether for Cook Children's as you guys grow, or for other entities to work in that space. And then entrepreneurship, startup support and commercialization is another kind of broad-based hub, that the idea is this becomes a kind of node for collaboration between A&M as well as other university partners, along with industry community partners as well. On the bottom are 4 sector-specific ones. And those 4 sector-specific ones, again, should be familiar to you. Obviously, healthcare innovation is on there because of where we are standing right now. Cook Children's, I would highlight in particular, but really the entire medical district and everything happening down here makes this a logical one for us. Agriculture and food innovation. Turns out there's actually a lot of interesting work going on in Fort Worth in this arena. A&M, obviously, is a land-grant school, has a lot of strength in this area, so it made sense as well. Aerospace and aviation innovation, again, an obvious one. And finally, media and entertainment, and this, this is a big priority for the community in terms of growth over time and what we can accomplish in that regard. So then the theory is that, if you have on the left side the whole length and breadth of A&M, and I won't go into this too much, but if people are interested, and Q and I can say more, but the A&M system is 11 universities, obviously A&M College Station that you know, but Tarleton State is an A&M system school, Prairie View is a system school, West Texas A&M, East Texas A&M, 11 universities are part of the system, but also 8 state agencies. So there are these 8 state agencies that are state agencies in every sense of the word, but they are operated, administered, run by the Texas A&M system. So a lot of the opportunities for collaboration, whether on research, workforce training or otherwise, actually have tie-ins with those agencies as much as anything. So we've got those. On the far end, we've got industry partners across different sectors, key sectors that we have identified some and will grow over time. And then the idea is that these innovation hubs become kind of the meeting place for those industry partners on the one side and the academic university system assets on the other hand. We've been busy with this work now for probably, let's call it a year and a half, kind of in a substantial way. And this slide actually, we probably need to update it because I keep saying it's 6 months old. So this slide is 6 months old, but it gives you a sense of the kind of the length and breadth of companies, big, small, and everything in the middle that we are in conversation with about how we can partner, how we can collaborate, how we can advance their research agenda, meet their workforce training needs, meet their long-term staffing needs, so on and so forth. So we've been pleased to see that success in that regard. Okay, so that's the aspiration. It's a pretty highfalutin aspiration. When people ask me to draw an analogy, the 2 analogies I can draw, which are, depending on what you know about Cambridge, Massachusetts, are both pretty crazy. So one is Silicon Valley. We all know that. The fundamentals, if you think about what Silicon Valley is and what has happened in Silicon Valley, it was the marriage of a pair of significant higher ed institutions, Stanford and UC Berkeley, a group of, not many, but a small number of well-established, significant corporations, National Semiconductor, probably most significant among them, and then a bunch of people sitting in their garages, right? That really was what Silicon Valley started with. And today, it's Silicon Valley. Okay, now, are we gonna have Silicon Valley in 5 years or 10 years? Of course not. But is that aspirationally how we think about what we can create in terms of this innovation ecosystem in Fort Worth? Absolutely. A more tangible example, for those of you know, probably the leading biotech innovation hub or location in the country now is Kendall Square in Cambridge, Massachusetts, just outside Boston, or it is Boston, to the eye of the outsider, right across the Charles River. It started 40 years ago, 50 years ago as MIT sitting in a barren wasteland of nothing. There was really nothing there around it. But incrementally, year by year by year, what happened was that initially MIT, but then others joined, other universities joined, ultimately companies joined, in collaborating around how do we build on what we have here to do more, progressively more and more and more. To the point where today you have companies really now from all over the world that have located to some degree or another in Kendall Square simply because they have to be in Kendall Square. So there are companies, Fort Worth-based companies, that have empty lease space in Kendall Square simply because they have to be in Kendall Square, right? That's what they've created there. Now that, again, took 40 years for that to happen. As I like to say, we're Texas, though, so we'll do it in 20. But that aspiration is a very practical, very realistic one, but a very ambitious one as well. That's really what we are hoping to create. All right, so what does A&M bring to the table in terms of the health space? Because now I want to focus on that in particular. So let me start with the broader Texas A&M Health, the apparatus, and then turn from there to say a couple of words about the College of Medicine. And Sue Bailey, who is from the College of Medicine and represents the dean, is here, and so I want to acknowledge her as well. She knows much more about all this, and so she can correct in Q&A. Maybe she can correct anything I get wrong. But first, a couple of words about the Texas A&M Health broadly. So in terms of scope, 5 schools, the dentistry, medicine, nursing, pharmacy, and public health, located across 7, there's other located, but 7 campus locations around the state, in Bryan College Station, of course, but also Corpus Christi, Dallas, Houston, Kingsville, McAllen, and Round Rock. But in reality, the reach, and this is a little bit of a reflection of A&M more broadly, its reach extends, A&M Health's reach extends to nearly every county in the state of Texas to one degree or another, 254 counties, where A&M is involved to one degree or another. Oh, did it go away? I didn't move fast enough, apparently. No, went ahead. I'm gonna go back. Good. Okay. So broad engagement in that regard. A couple of other statistics about it. 32 degree programs offered across the 5 schools within the Texas A&M Health. More than 400,000 annual direct contacts made through community education, the programs of Texas A&M Health. More than 40 major clinical associates and 142 affiliated residency programs of Texas A&M Health broadly. Key priority areas for the A&M Health Sciences: rural population health, military health, and innovation through engineering are 3 of the big important areas. A lot of initiatives have followed from this. A few key ones: Healthy Texas is a big initiative of A&M Health Sciences, the Global Institute for Hispanic Health, the opioid task force of the system, and then the A&M Rural and Community Health Initiatives. And then there's a huge range of centers and institutes that operate within A&M Health Sciences. I'll name a few of those just to give you a sense of the breadth. I think there's 27 or 29 in total, but a Center for Airborne Pathogen Research and Tuberculosis Imaging, Center for Infectious and Inflammatory Diseases, Center for Translational Cancer Research, Center for Excellence in Forensic Nursing, the Texas A&M Center for Innovation in Advanced Development and Manufacturing, just a couple more: Cardiovascular Research Institute, the Texas A&M Health Institute of Pharmacology and Neurotherapeutics, and the Texas A&M Institute for Regenerative Medicine. So you get a sense of, again, incredible breadth and array of the research scope and the scope otherwise of the A&M Health Sciences operation broadly. So what about then the College of Medicine in particular? A couple of words about the College of Medicine. So I won't go through all the degree programs that you see them up there. It's obviously the traditional MD, as well as an array of PhD and master's degree programs, and then lots of joint programs as well. 212 full-time faculty of the College of Medicine, the 2,349 clinical faculty within the operation. In terms of students, 815 MD students being trained at the College of Medicine, 195 PhD and master's students, and more than 1,000 residents and fellows affiliated with A&M College of Medicine as well. They recently underwent a complete revision of the entire MD curriculum. Again, I think, A&M, back to this land grant mission notion, the A&M has prioritized ensuring that the curriculum, the folks who are going through the A&M MD program, and as well as other programs, are well prepared for the current moment. And so wholesale revision on a bunch of axes, including additional programming, additional education in the AI space. In terms of research specialties, again, some listed here: translational medicine, primary care and rural medicine, biochemistry, cancer, cardiovascular and integrated biology, cellular biology and genetics, microbial and molecular pathogenesis, neuroscience and experimental therapeutics, engineering medicine, and military medicine. In FY24, more than $62 million in research expenditures and research dollars. And in terms of NIH awards per faculty, roughly comparable to the University of Texas in that regard. So good numbers there too. Key priorities, again, key areas of the College of Medicine. You can see some overlap with what we heard earlier. Aerospace medicine, space medicine is a central area of interest. Patient care, of course, research and innovation, and then rural medicine as key areas. Space medicine in particular is a fast-growing area, as is rural medicine. These are key big areas of growth that we are seeing. So what about then collaboration opportunities that we can identify and potentially explore together? Let me start here with I think the earliest, there may have been other smaller things, but the earliest kind of tangible Fort Worth collaboration between Cook Children's and A&M actually came via the law school. So together with Cook Children's, I think it's now 4 years ago, maybe 5 years ago, we established what's called a medical legal partnership. The core idea being that for a lot of the patients who come to you and that you treat and you see, you can do incredible work in terms of treating their medical condition, but it turns out fundamentally there is some outside non-health, non-medicine related driver of their health outcomes. So for example, the one I was using as a kid is suffering from lead poisoning. You can do whatever you can to treat it, but if they go home every night to their apartment with chip lead paint, you're not going to be able to, over the long term, do much. On the other hand, that's what lawyers do, right? We do figure out how, as a matter of landlord-tenant law, we get that lead paint dealt with. If someone is not taking their medication because they're not getting their veterans, the parents are not getting their veterans benefits, there's only so much you can do, but there are things that we can do, right, through our clinic. So this medical legal partnership, the idea is that, and this is with Cook support, I should emphasize, there are lawyers and law students who basically help meet these legal needs of Cook Children's patients. It's been incredibly impactful from all indications, and in fact, so much so that it's now become a model. What Cook and A&M have done together has become something of a model already statewide, so we have multiple medical legal partnerships now across the state, including down in the Rio Grande Valley and Bryan College Station and elsewhere, and even with the U.S. Department of Justice, we have established one recently, and we are now beginning to think about how we carry that model nationwide. So that the origins of the collaboration really started with, I'm proud to say, the law school. But thinking ahead, what are possibilities that we can think about? Some of these are already in preliminary stages of discussion. Other ones are kind of, really just ideas, right, at this stage. So what are some of those collaboration opportunities? And again, I highlight these mostly with the goal of stimulating your thought. Obviously, if there's feedback on these, great. But likewise, to help you think today and later on about where there might be additional collaboration opportunities. So a few, again, in no particular order, starting with a few disciplinary ones. So in the neurology space, for example, obviously an area of real strength here at Cook Children's, are there opportunities for clinical trial collaborations that we might pursue in that space? So for example, A&M developed therapeutics in epilepsy, traumatic brain injury, and otherwise that we could imagine Cook becomes a trial site for those therapeutic treatments. From there, in turn, then, we might capitalize on Cook's clinical expertise broadly, but maybe particularly in those areas, to drive future A&M research, right? To identify what are research opportunities that we might pursue. Again, epilepsy, movement disorder clinicians might connect with, at Cook, might connect with translational science researchers at A&M, who then develop basic science to help meet Cook clinical needs, right? That's really the opportunity that we see for collaboration in that regard. All right, so that's neurology. What about endocrinology, another area? So again, you can imagine clinical trial collaborations here with Cook's clinical experience driving A&M research. A particular one, and this comes from conversations with Will, familial hypercholesterolemia, which again, you are particularly, Cook Children's is particularly notable for your screening work in that regard, that you screen every 2-year-old who comes in for their well child exam in your neighborhood clinics, that you examine for that. It's a disease that affects a substantial number of folks around the country, but NIH has indicated that fewer than 10% of cases of it are actually being diagnosed and identified, with obviously significant health outcomes. So given Cook Children's expertise in identification, and A&M's expertise in scaling and developing programs, can we imagine doing something together in that space? And in that regard, potentially even finding outside funding, going to the legislature to say, here's this condition that we know is there, we are not identifying it with frequency. Cook has a framework in place. A&M has these strengths in terms of scaling. Is there funding available to be able to advance them? Precision medicine is another area, again, that we might think about and explore. So you're building an incredible precision medicine program here, given your large, diverse patient population, your master clinicians, and your centralized research infrastructure with expertise in clinical trials. The A&M, meanwhile, has expertise in infrastructure in the basic and translational elements required for precision medicine diagnostics and therapeutics. So, for example, in terms of diagnostic workup of N-of-1 drug development and taking that to scale for population-level metrics and therapies, you can imagine that A&M brings something useful to that precision medicine expertise of Cook Children's. Lots of potential applications of that, and again, these are not my expertise, so I'm going to acknowledge kind of Will kind of as identifying, some of these opportunities. But so in the area of fibroblast cultures, you can imagine A&M developing cell lines drawn from Cook patients for diagnostic and drug development purposes. Functional testing, so A&M could create molecular and cellular models from Cook patient genetic variants to assess pathogenicity. The genetic counseling, A&M is building, has just started to build a significant program in that space, and so you can imagine A&M providing genetic counseling to serve your growing needs here. Cook providing clinical opportunities for students in that genetic counseling program. Population precision medicine, back to there, that Cook could partner with A&M's broad reach to identify diseases in the population broadly that are underdiagnosed. Another one that we've had some significant conversations about and is actually, I think, making some good headway is the idea of creating a biobank. Could we create a biobank for North Texas to house tissue and data for clinical and research purposes, for disease diagnosis, biomarker discovery, and the development of natural histories. So significant opportunity here for novel therapeutics, for collaboration on novel methods of data integration and data sharing, all of which, again, has the promise to advance research in an array of significant ways. In this sense, again, then, North Texas's clinical needs, the ones we identify here, can help to drive A&M research initiatives. And here, again, we see opportunity for significant outside funding, whether state funding or private funding, to help support the creation of such a biobank. I'll sort of begin to wrap up the ideas that I would throw out for you. In terms of students, obviously lots of opportunities. 124 A&M students from the College of Medicine rotated at Cook in 2023 to 2024 for clinical rotations. They've been involved in research while they've been here, and we can imagine building on that over time. It's been small numbers of students so far, but they have been involved in a significant way with some of your research initiatives, and so we'd love to see how we can integrate them further. And then the same might extend to undergrad and grad students as well, in terms of basic translational collaborations in research. I'll mention one more that we've had some conversations about, the idea of a next generation simulation lab, so we can take advantage of A&M's strengths in this regard, in terms of simulation, computer science, graphics design, to help develop simulations for surgeries, cardiac, orthopedic, craniofacial surgeries, to test potential outcomes for surgery. 3D printed materials, again, another area in which A&M is investing significantly in growing, and the use of that, and simulating emergencies and contingencies in complex surgeries, so to help the surgeons at A&M be able to do more in that regard. So again, lots of examples, but these are really just examples. Again, as I mentioned, some of them are in early stages of conversation. Some of them are just, at the stage of they're just ideas for now. But we're excited to get your feedback and your thoughts on how we might add to those, build on those, and do more. Quickly then, let me just sort of wrap up before kind of opening it up for that feedback. And again, any questions that I can at least try to answer. So part of this is the physical presence of A&M. If you've driven by downtown, you know that process has already started. But just to give you kind of situate it slightly more broadly, what's happening down there. This is that southeast corner of downtown as it stands now. So if you think of it, this is across the street from the Water Gardens, near the convention center, kind of, again, southeast corner of the downtown quadrant that we might think of it as. This is what it looks like basically at this stage. 3 buildings that are immediately either under construction, the one you see, or in an advanced state of design that A&M is finalizing those designs for, are this lawn education building, which is under construction, Research and Innovation Building A, we call it, and the Performance, Visualization, and Fine Arts Building. The lawn education building is intended to be an academic facility, not just for law, so the education part is meant to capture. There'll be engineering labs in there, there'll be biotech labs in there, nursing, other health science related kind of space in that pharmacy, and others in that space. The Research and Innovation Building will be a space that really is where these collaborations play themselves out. So these hubs will be based in significant part in Research and Innovation Building A, and the idea is that that space is a space where researchers from Cook Children's, researchers from, for that matter, Lockheed and other companies, they would come together with A&M students, faculty, staff, and programs to collaborate in research. And then we'll have more of that over time. And then the building on the far left, this Performance, Visualization, and Fine Arts is meant to respond to the interest in building the film and TV industry in Fort Worth. So one of the needs for that is these pretty complex sound stages. A&M has a real strength in that area. And so A&M, with some significant amount of state funding, plans to build one of those what's called virtual production studios right here on the edge of, in downtown, for use by A&M, but also use by the broader community. This is the building that you see under construction already. It doesn't quite look like this yet, but it's getting closer if you drive by and see it. So this is the Law and Education Building. This is that second building, the Research and Innovation Building A. You can see to the right of it is that first building, the Law and Education Building, and so this will be just to the north of that. And this is a kind of a rendering of what that performance and that virtual production studio will look like at the end of the street. When all is said and done, when we put these pieces together, what had been that barren wasteland kind of thing in South Downtown will instead look like this. So we're hopeful that, again, when I talk about Kendall Square or when I talk about Silicon Valley, this is really the beginning of that. And if you think about that area, there is a lot more all around it. And the real hope is that this drives growth, not just on A&M property, but all around it as well. Okay, so that's the physical space. I'm happy to talk about that too. But really, most of all, I want to hear from you in terms of ideas and suggestions in terms of things that we might do together. So let me stop there and thank you.
Can't go first every time, but I will.
And I'm a law professor, so I may call on you. That's just to prepare you.
So I have a question.
Yeah.
So you had that slide that showed the 4 locations and all the specialties.
Yeah.
And so where are those located? Like I was interested in obviously the neuroscience and I can't quite recall what the specialty was. But where are all those located? And are there going to be certain of those fields from the College of Medicine that are going to be located in Fort Worth?
Sue, do you want to say a couple words about that? Probably you're more capable to comment.
Thanks. I'm Sue Bailey, retired allergist from Fort Worth, and now serve as the medical director for our Institute for Healthcare Access, and a special assistant to the dean. All of the College of Medicine's basic science departments are located on our Bryan College Station Health Science Center campus. And but they are very interested in collaborations up here in Fort Worth. We're hoping that some of that laboratory space that you see in the gorgeous new buildings that are going up downtown will be there. But that's all in process and to be determined. It's just limited by our imagination.
Yeah, that's what I think Sue captures it better than I would. But it's. This is really where, and it's weird because again, there's a chicken and egg thing that we've been navigating for the several years that this has been under discussion of, I will be asked by everyone from the mayor to the CEO of Cook Children's and whatever, say, so what are you going to do here? And I say, well, what do you want us to do here? And they say, well, what are you going to do here? And these conversations, at some point it's very tiring, but it really is the case that, again, I think, and I give A&M credit for this, I'm not a born Texan or born Aggie, I'm adopted, as I say it. But I give them credit. That really is the way that they are thinking about this, is they want to know what are the opportunities in research collaboration that would be significant here. It doesn't mean like the next day they show up, but that's really, they want to know so they can see if they can make that opportunity happen.
Well, I would love for this to show up tomorrow, but...
Okay. And to be clear, some of it is showing up pretty fast, but yeah.
My name is Candace Gamble. I am the medical director here for genetics, and one of the challenges I think we face is the newborn screening efforts here in Texas. We are one of the only states that screens kiddos twice, so that's some 400,000 births in Texas times 2. Yeah. So we get 2 newborn screens and sometimes 3 for each baby. Yeah. And then we face challenges as it relates to centralization of the newborn screen. We're also one of the only states that does not have a central location where that patient's primary care doctor can actually go look up the result, figure out who they talk to. We get faxes. It goes to the PCP, then it goes to the genetics center. And depending on the disorder, there are maybe 7 places that it goes in the state. Yeah. And sometimes those babies show up to the ED, for instance, at midnight because they were told they had an abnormal newborn screen and no one knows what to do because we don't have a centralized location for those results. So that's challenging. We also could use some great ideas as it relates to who's responsible for working that up. With only 7 locations in the state and very limited genetics resources. We don't have nurses, for instance, at each institution or each screening site that actually helps work those up. They are housed in the state now, So those are some ideas, I think, from our perspective in genetics that and even other specialties, endocrinology, they get newborn screen results. A lot of other specialties do as well. We're looking for some help in that.
Awesome.
regard.
So I took some notes. I should mention, so Sue, you saw already, came up to the microphone. And Sue, I don't know if you want to add anything on that, but I should also mention Denise Canales is also here, who's actively involved in kind of our building out in this space. Used to be at UT Southwestern, and then we brought her over to help us with some of those efforts. So I wrote down my lawyer version of it. But connecting with Sue and Denise probably is helpful as well. Yeah.
Hi, I'm wondering anything about public health. I have my MPH from A&M, so
Yep.
of course next programs would be great.
Yeah. So here's what I can say is the School of Public Health is incredibly interested. When did you graduate?
When did I graduate?
Yeah.
2019.
19. Okay, so really, roughly in that time frame, the growth and demand has been huge, and so it's one of those where they're ready to go, but they've got 6 other things that are kind of immediately in front of them. So my guess is that public health will be, in terms of substantial physical presence or engagement up here, we're probably a year or 2 out before they get to that point, but they want to do it. I mean, they've identified particular degrees that they want to explore and this kind of thing, where they see an opportunity and need. That said, where there are particular opportunities, I think they're super entrepreneurial. They're, as you know from having gone there, they're a super entrepreneurial bunch. And so what I would tell you is that if you identify to me, to others in the room, kind of where opportunities are that you see, we're happy to carry those to Sean Gibbs, the dean, to make sure that he's got those weaved in. And some of those things may be easier to move on quicker. And so we'd love to pursue those.
Thank you.
Hi, thank you for that excellent talk. I would like for you to be a little bit more granular about a biorepository. Specifically, kind of talk about what's available within the state, and then how you foresee that integration a little bit more with people doing more clinical research, because when I think about biorepository, you're intersecting a lot with research scientists in other areas, please.
Yeah. Okay, so I'm going to give you my extent of it, but again, we'll hit the wall very quickly. So as I'm doing that, I don't know if Will is still here. So Will or Denise or Sue, if you want to say anything further about the details of what's details. I mean, again, very early stage, but some of the details of the conversation. So the broad notion is that this is a need, actually, really statewide, but there's a particular opportunity here, right, just because of what we're doing and the level of interest right now. And so it's a little bit of a hub and spoke kind of model that they're giving thought to, that, that if we can get the funding for it, that there would be some kind of, hub of activity that would be in College Station, in Bryan College Station, but then there would be kind of spokes that would go. We're already talking to Houston as well as in Fort Worth, but that Fort Worth, just given our momentum and our speed, would be the first of those kind of nodes that we would pursue. So that's a slight response, I hope, to the, how are we thinking about this as a statewide need and not simply kind of, we're going to do something random in North Texas or something random in Fort Worth. I don't know, Will, do you want to say more?
Yeah. No, I think the biobank question is a great example of you guys coming into town saying, what do you need?
Yeah.
So you think about the amount of tissue we throw away every day, right? And it's just refuse. But then if you think about what's happening in the world with precision medicine, the more we can know about your tissue, the better. And when you get cancer 20 years from now, what if we had some cell line of yours 20 years ago, right? All those things are super important clinically, but we have no need currently to go store all that stuff. Then think about what A&M's doing, and they need tissue, but they don't have an active disposer of tissue in their system, like us, right? And so I think what I'm super excited about all this is these things that are really hard for us are easy for you, and things that are hard for you are actually fairly easy for us. And I think that's the circle this thing goes around.
And again, to give the kind of the evolution of this, or the ideology of this, you might say. So we identified it in some early conversations with your team here as a need. It's now the case that I think it's 3 people. The A&M has hired already 3 folks, have brought them on staff already to help effectuate this biobank possibility and idea just in the last 2 months, 3 months. So that's again, I use that as an example of the kind of thing where if we can identify those things from the Cook Children's end, from the Fort Worth end, we can then, A&M can add its piece to it.
I'm going to keep us on time. We have a minute, but I'm going to mention here something that came up in the last talk. John Whitehans from UTA gave us an overview, and A&M's UTA collaboration in biomanufacturing at Bridge.
Good.
Immediately from that, a question from an Aggie around good laboratory practices. And so there's a lot of activation energy required to bring ideas to fruition, so GLP and GMP. And what if, A&M and UT got together and they lowered that activation energy from the state, right? The time where a clinician can identify a problem and then go build it in his garage, right? So that did happen in Silicon Valley. That's gone though. For precision medicine, for the world that's coming, gene therapies, that kind of thing. But we still have the expert in phenotype. We still have the expert in identifying if that kid has that problem. And then if you could connect with scientists, translational scientists, and then you lower that activation energy, because like GLP and GMP is hard. It's just technically hard. People don't want to do it. There's a training aspect to it, but UT and A&M could do that. And what if y'all were the consultants, the state agency, whatever this was, that guaranteed idea comes in, consultant fee, and then we guarantee you it's going to meet spec. That currently kills, I don't know how many ideas.
Well, ideas get lost along the way, this valley of death, you can think of it, or whatever,
Yes,
the version
exactly
of that.
Yep.
But no, so yes, and again, and that's, I took down some notes on it. What I would say more broadly, and again, I'm glad John mentioned the therapeutics collaboration that we have at Pegasus Park. It really is a reflection, though, of the degree to which, again, we are really thinking about this in exactly that regard. If there's something more that we can do together with UT, together with TCU, together with UNT Health Science Center, we're super excited about that, because that's really kind of what motivates everything that we're doing.
What I heard was Cook Children's had an Aggie say he does not hate Longhorns.
Exactly.
Excellent.
You can say that. That's okay. I'm okay with that as the headline. Okay.
1:15. Thank you very much.
Thank you, everyone.